Hello, world, and welcome back to the Glen Alex Show. Our mission is for you to be joyful, connected, confident, and complete. The life experience we call wealth, WELLTH, which is health plus other riches in life. I'm Glen Alex, the wealth counselor, clinical social worker, and author of Living in Total Health. My life's work is about health because healthy people are more genuine, more giving, and more loving. And physically, mentally, emotionally, and spiritually healthy people do not intentionally harm self or others. Please take a second and think about that. The violence that's being perpetrated in our homes, in our cities, in our states, in our country, and yes, around the world, is being perpetrated by unhealthy people. Those who are balanced physically, mentally, emotionally, and spiritually, I believe, will lead us to healing. And with that, please help me welcome my guest, Mr. David Tatlock, to the Glen Alex Show. Hi,
Hello.
David.
How are you doing?
I am doing well, sir. How are you?
I'm good.
Good. Thank you so much for taking time out of your day to be here with us.
Oh, no, I'm happy to be here.
Okay, great. We have some interesting stuff to talk about. First, tell people who you are.
Um, well, I'm Dave Tatlock. I've been a physical therapist for 27 years, been in sports medicine, was a certified strength conditioning specialist. Uh, I've been a teacher. I was a high school teacher and started medical academies here in Vegas for 10 years. And recently I've been more involved in nonprofits and also started a band about 4 years ago. So we play all around the city and stuff. So different people know me here in Vegas for different reasons. So I've kind of got a lot of hats, and I'm realizing that as I have conversations with people and like Facebook, when I get into discussion on coronavirus, they're like, "You're a lead singer of a band. What are you talking about?" And I'm like, "Oh, yeah, you know." So yeah, but I've lived here in Vegas since came here in 2004, so we've been here 16 years. So.
Okay, okay. And it's great that you have a support group for each hat you wear.
Yeah.
That's awesome. Okay, well, let's just dive right in. One of the reasons I wanted to talk to you was because I have been following your updates about the virus, and I saw you posted your bio the other day, and I had no idea that you had so much. Your credentials were so many, and I do want to say that I appreciate your posts because you don't politicize them. You don't engage in that political bantering and blaming one politician or one party over the other. And I really appreciate that. You stick to the facts. You give your opinion, but you
Yeah.
stick to the facts and the medical information that's available out there. So thank you for that.
Yeah.
But I want to know a little bit about your experience with Cirque.
Yeah, that's so the reason I came out to Las Vegas was to work with Cirque du Soleil. So uh, when I came out of college, I graduated from Indiana University in physical therapy, and I got the opportunity to do a sports medicine fellowship down at Auburn University with one of the most famous sports medicine doctors, Dr. James Andrews, who's pioneered and perfected numerous techniques that professional athletes go to him to get surgeries on. So after that, I worked in Ohio for a while in sports medicine and was a strength conditioning coach at a high school, along with working in the clinic. And I just wanted something different. So I started looking, and I'd never heard of Cirque du Soleil. I didn't know what they did. I just sent my resume in and applied and said, "Oh, it looks like it's kind of like a team thing, or there's some athletes they work with." I mean, I had been, I had done plays and stuff when I was in high school, but I really didn't know, I had no idea what was going on
What
out
you
there
know,
in Vegas. I was in the Midwest, right? And nobody
right?
performed. I mean, I kind of wanted to be an entertainer growing up, but no, I didn't know anybody that made money on entertainment, acting, music. It was like you found a good paying, good job and you took care of your family and bought your little place of land, and that's the Midwest way, right? So,
Right.
so I applied, I got called, and I interviewed for a job at Disney World, and I thought the interview went really well because they have a show there called La Nuba. Loved the show. It was awesome. I came back home. I said, kids, I think we might move to Disney World, you know? I was really excited, but when they called me back, they said, we really loved your interview. And I'm like, yeah, I'm going to go to Disney. And they're like, but after talking to you and your experience, we want to use you in a show we're opening in Las Vegas. And I was like, what? Like, I don't want to go to like people in the Midwest. We don't go to Las Vegas. Like, I heard a guy say, said, Las Vegas is like, it's not hell, but you can smell it from there. You know, like it's a, it's a bad place.
That's terrible.
People in the Midwest, like Las Vegas, you know. So I came out here and interviewed and saw the show, and I ended up working at KA at MGM.
Okay.
And it was amazing opportunity. Just I saw so many cool things. It was the first time in my life I saw somebody say, hey, I want a purple train to run on a ramp right in this scene. Build that. Go. And these people would build these things from nothing. Like, it was amazing. The theater is humongous. People that see the show, they don't understand how big the theater is. If you look over the stage when everything's down, you can go about another 90 feet, and there's cement there. It's a huge hole. They built a crane that goes up and down and twirls the stage around with a little arm. It was crazy, and the people were awesome, and I got to work with great, fabulous athletes from around the world. I learned a lot more about gymnastics. Cirque has a lot of acrobatics, a lot of gymnastics, and other things too, actors and singers and all that. But it was an amazing experience to open a show, and we had to develop all the medical protocols for rescues. I had to learn how to, you know, we had to write up protocols. How do I rescue somebody stuck in a twirling stage, you know, or how do we rescue somebody stuck up on a lift, you know, 150 feet in the air, and all this stuff. So I did EMT training with Cirque too. So I was an EMT and did strength conditioning and helped devise some injury prevention protocols for them that cut our injuries about 50% the first year that we implemented them. So it was a really good time. It was a good time.
That's fantastic. And actually, Mystere is my favorite strip show. I've seen it like 8 times.
I love Mystere. Mystere is a fabulous show because you're so close and they're doing so many amazing acrobatic things right in front of you. It has great acts, and they do all that stuff in the other shows, and in KOT's amazing too. But Mystere, you're right there. You're
right there, and just I'm so fascinated by the feats they do with the human body. It's just amazing what they can do with the human body. So, you know, I'll go see it again when it opens. So, but thank you for sharing that.
At KA, so they have this thing called the Wheel of Death, right? It's 2 guys are in this wheel, and they're it's like a little cage, but it's open on the sides. And then they get out of the cage, and they go on top of the wheels while they go around. Scariest thing you'll ever see up close. And one time the guy that's in it, I said, man, I'm so worried you're gonna fall. Like if you fall out of that, you could land anywhere in the theater. Like, I don't know if we're gonna be able to save you. He's like, don't worry, I've only fallen twice. I'm like, like what? And he would start laughing. And these guys, I mean, they're just risking their life every night out there. He's on top of this wheel, 90 feet up in this huge theater. He could fall anywhere in the theater if he falls. And they just do it like he's jumping rope on the thing. It just makes you want, it's freaky how crazy these people are. So
yeah, that's very cool. Very cool. But I also wanted to talk to you about what attracted you or what motivated you to start doing the research on coronavirus and posting about it.
Well, I think I'm like you guys, right? I was like, hey, how likely am I to die from this? You know, what should I be doing? What should I not be doing? How scared should I be? Right. So when it first was coming out, it was like, oh my gosh, we're all gonna die the way the media was doing. And I'm like, So I do what I always do. I go to research. As a healthcare professional, we're trained to look at research studies. If I present at a conference in the healthcare field, you can't present at a conference, and some other fields, or you have to have all these studies to back up what you're saying.
Right.
You can't just go up there and say, "Well, I think I believe the proton theory means all the positive charges are going to just get rid of everything that we see in the picture." Hey, you can't do that in healthcare. You have to have studies. You have to base your statements on studies. So what I did is I just started breaking into studies. I'm like, well, let me research this thing. So I go to PubMed and different things, and it started out just trying to help my friends and family start to understand what they can do, what shouldn't they do, how dangerous is it, how isn't
Right.
dangerous it isn't. So that's how I got started, and then just as I keep digging and reading the studies and different things, I'm like, a number of healthcare people that they're interviewing, they act like they forgot parts of immunology, basic immunology 101, and because like nobody was talking about T cells. Since the beginning, I've been like, we know T cells are the main thing that fight viruses. Why is there nobody talking about the T cell response? It's all like antibodies, and there's only this much antibodies and all this. So
Well, why do you think that is?
what I started noticing, and I don't care about the politics of any of this. All I care about is good information.
Okay.
And what it seemed like was there was a faction of the media. It's like, oh, awesome. The worse this is, the worse it looks for Trump. And the worse things look for Trump, the more likely it is that he'll get beat. And then you get the faction that get behind Trump, and they'll spout off some stuff too that's over the top, that isn't in context and factual. What you have happen is the media will tell you some of the facts, but they leave out a lot of important facts. Now, I'm not
And
saying
that's on any topic.
yeah, I'm not saying all. I think the local media is the best place to get your information, but the mainstream media, it became a very much a narrative-driven story, depending on if you were against Trump or for Trump. And I realized, like, man, I've got to just find out clear information for myself, and that's why I kept digging and studying. So.
Okay, so why do you think that even people in the medical community didn't focus on T cells in the beginning?
I think there were people that were, but their voices were not being heard, or they were being drowned out. Like they weren't on the interviews. They weren't called up to be asked about what is MSNBC or what does Fox News think about what they believe about T cell. I mean, on HIV patients, we make them come in and get their T cell measurements done. That's the way they monitor the disease, is how are your killer T cells doing? And once those drop to certain levels, that means different things have to happen. So so that bothered me from the beginning, that nobody was talking about T cells. I was like, I know that's immunology 101, that we know about T cells, that they don't they don't fight based off antibodies. They attack right away on anything that's out of the ordinary.
Okay.
And so when I saw that wasn't really being talked about, I knew that there were narrative-driven stories going on. I knew we were missing some things. So, because that's just a basic. So, and then I thought it was very interesting that one nation just decided we're not going to lock down. We think we don't need the lockdown. We're going to manage it a different way. So now they become a test case, right? Sweden. They become a test case for this whole thing. And most people don't realize the Nordic countries are pretty much not wearing any masks at all. So not just Sweden, Denmark, Finland, the Netherlands. I mean, the Nordic countries, they're not wearing masks at all.
That is interesting.
Yeah.
Why?
They didn't believe. I think they believed, what I would say is that the science behind mask wearing is very weak at best. Doesn't mean it doesn't help. Like, I would still recommend for people to wear a mask, because I think common sense tells you it helps stop some of the particles coming out of your mouth. You know, if you watch video, now there's more and more studies being done with video and fluorescent spectroscopy and stuff, where you see all the nanoparticles being emitted when people talk, cough, breathe. And the mask, most holes in masks are bigger than the actual virus, but the virus is carried in some of those droplets. So if it helps at all, then just wear the mask, right? But what they're saying is the science is pretty weak, meaning that there's not a study that proves conclusively that COVID-19 spread is decreased with mask wearing.
Okay.
There are studies that show maybe decreased flu transmission or decreased particles hitting a board or something. So if you follow some common sense logic, it probably would mean that mask would help somewhat. But they're saying the science is kind of weak. And I would say, I agree. I think I would say on masks that I would wear them, but the science isn't super strong on them. But I think there is weak evidence that they work. So wear them. If it can help at all, then wear them. And
Okay.
what I think we're seeing now, and if you there's a guy online called Z-Dog. He's a physician that used to practice in Vegas. He does music videos for medical stuff, like you know, spoof type videos, and has fun. But he has a show on Facebook where he talks about all these issues. And what I think we're seeing now with masks is if you get less virus, your infection is just not as severe usually. And the masks might be helping decrease the amount of what is called inoculum, or the amount of virus actually getting transmitted to you. So the more virus that lands inside of your mucous membranes, probably the worse your infection is going to be. So masks might not stop the infection, but it might decrease the amount of inoculum that you get from another person. So that's a good thing too. So
Okay. So the countries that are not wearing masks, how are they doing compared to us?
well, I love kind of tracking Sweden, right? Because they did it in a way nobody else did.
Hmm.
And I'm not saying we should have done their way or we shouldn't have done their way. I'm saying we won't really know all the data well until we're on the back end of all this. When this thing is calmed down and it's either gone away, or we have a vaccine, or the incidence is less, then we'll be able to start doing some looking back at who made the best decisions and why they were the best decisions. But right now, Sweden, I mean, nobody's talking about Sweden, but they're pretty much at herd immunity. I mean, they have less than 100 to 200 cases a day. They have 3 or 4 hospitalizations a day, and they might have 1 or 2 or no deaths per day. So I go monitor Sweden's information from their direct public health website. I don't
Okay.
depend on worldometers and all this. I go to their public health website and it clearly lists their numbers, and their numbers are almost in the toilet now. Like they don't have that much. So they had no vaccine, they don't wear masks, and their approach was, and they didn't do it soon enough. Their approach was protect the elderly while we let the young get it, who it doesn't affect that much. And as that spreads through the healthy population, then we can start letting the older people reintegrate. And they still advised keeping distance, no big gatherings. And the people there seem to respect their government, uh, believe their government a lot more than we do here. We have a healthy suspicion, I don't know, unhealthy, healthy. Americans are not big on the government telling them what to do, but in Sweden, they're usually, they go along with the government. They believe the government has their best interests in mind, and so they kind of followed those guidelines. And now they're at like 570 deaths per million, but 85% of their deaths were 65 and over, and most of those, 75% of them, were in elderly care homes. So they have very few deaths among younger people, and their population is definitely healthier than the U.S. And that's, we'll get to that when you're talking about what's screwed up about our healthcare system here. But we're not a healthy nation. So Denmark and Finland have very low infection rates. They locked down pretty hard early, and they're letting people out, but they're still not really using masks. And their death rates, their mortality rates are very low. So Sweden did not do as well as the countries right around it. But what they're saying is, as you let everybody out, the virus is waiting on you.
Yes.
And if it didn't get out, if you didn't get close to community immunity or herd immunity, it's going to start infecting again. So what they're saying is, you're going to catch up with us. As you start doing your normal society, you will catch up with us. And right now, Europe has re-outbreaks in every country except Sweden. Some are large re-outbreaks, some are medium, and some are small, but everybody's cases in Europe are going up. Sweden's are not. They're still going down. So
interesting.
we'll see what happens in the next 4 to 5 months. What happens? Do those other countries catch up? I mean, England, Spain is already well past Sweden in death rate. They have over 600 deaths per million, so they're farther along. Italy is more death than Sweden also. So there's already countries in Europe that have higher death rates, and they had lockdowns. So I just think it's interesting that a country said, well, we're going to do it different than everybody else, and so they're a test case. So
It's very interesting. And so how close do you think we are to herd immunity, given the data that's out there, if it's accurate?
So I think we are much closer than people realize, and that most of the media realized until about the last 2 weeks ago. So I kept on my page for 3 months, I've kept saying, nobody is talking about T-cell immunity. That meaning somebody could be exposed to something and they kill it right away before it even becomes an infection.
Right.
Now, we didn't know what was the immunity like with T cells. We were getting an idea of antibodies, right? Antibodies are something that are made in response and float in your blood for a while to help you respond better to an infection. But we had no idea about T cells. But about a month ago, Sweden came out with a study that said their T cell, that the immunity from T cells is 2 to 3 times greater than antibody immunity.
Wow.
So their antibody immunity was about 7 to 10% then. It's closer to 15% now in a lot of places in Sweden. And they were basically saying, if you add the antibody immunity with the T cell immunity, you're getting close to 50, 60% immunity, which some experts are guessing you got to be 60% immune before the virus starts to die out, right? Since then, there have been even more studies. So 2 or 3 weeks ago, they released that study in California where they took people's blood samples that they had gotten 3 years ago in 2016. And they said, I wonder if this blood will react to COVID-19. If the T cells or whatever will attack COVID-19, because these people have been exposed to coronaviruses before, colds, other coronaviruses and things. And what they found is 40 to 60% of all those samples attacked coronavirus, responded to it. So when I started reading this, I started even posting more on my wall, like, hey, it looks like about 50% of Americans are already pre-immune to COVID-19. They're going to kill it if they're exposed to it because of our previous exposure to coronavirus. Well, then you add the antibodies along with that. New York is 29% antibody positive, 25% in some places, 40% in some places. Upstates lower, like 10 to 12%. And what has happened in New York? They're opening things up, but the infection rate's not going up. Now, they're going to say, hey, it's because we have done the best shutdown job ever.
Right.
They have the highest death rate in the world. All right, New York and New Jersey are over 1,700 deaths per million, 5 times greater than Florida and Texas and all that other stuff. So the virus basically turned them out already, right? It went through them, it did its thing, and now they probably have herd-like immunity or community immunity. So many people have been exposed, So you take the 50% T cell immunity plus that 25% antibody, and guess what? You're at like 70%.
Okay.
So just last week, a scientist from a professor from England put out a paper, and that is published, that said probably the threshold for herd immunity or community immunity is 15 to 20% antibody positivity in a community.
Okay.
So if you look at Arizona right now, their antibody positive rate went up to 15 to 16% about 3 weeks ago. And if you look at their hospitalizations, it's gone, it's just dropping, like dropping every day. It has dropped now to June, early June levels. So what you're seeing is this 15 to 20% antibody positivity rate in a community. It seems that's when the virus starts hitting the wall, and we see infections drop. And I don't know if you know, in Clark County for 4 weeks, infections have been dropping. The 7-day averages dropped for 4 weeks straight. Hospitalizations have dropped for 3 weeks straight. Now, deaths follow all that, right? So the death rate was up until about last week. Now it's starting to drop. So you get cases, then you get hospitalizations, then you get death. So I guess what I'm saying is I feel like the situation could be a little more hopeful than a lot of people are putting out there, that we might be closer to herd immunity or community immunity than we realized before. And also, I believe we're going to have a vaccine starting to be shipped out in October, November. I think these studies are going to start rolling in. They're going to start having data this month, September. You're going to start seeing little bits of data about because there's 2 phase 3 vaccine trials going on right now with 30,000 people. People are taking the vaccine, and they're just waiting to see how many get infected with the vaccine versus a placebo. If it protects more than 50%, they're going to say, boom, that's effective. They already have these doses made. The shipment is already being prepared. All the ways to ship the virus is prepared. So all they have to do is get the green light, and that stuff's going to start going out. So I think with community immunity and the vaccine coming in October, November, I think the picture looks a lot better than we hear a lot.
And I agree with that. I get really frustrated how the media only focus on the number of cases and the number of positives. And that's why from time to time, I will post the number of people who have recovered, because that's important for us to know and for our politicians to make the right decisions and not just the political ones. And so thank you for that.
I do want to add, I'm not saying that the virus isn't serious. I'm not saying that a lot of people haven't died from it or been hospitalized. I believe it is a very serious situation. What we find from the data is if you're 65 and under with no comorbidities, no high risk diabetes, hypertension, if you're in general good health, 65 and under, your chances of mortality or serious effects is about the same as the flu. If you're under 25, it's actually less than the flu. There's more people dying of the flu under the age of 24, 18 years old than COVID-19. So for some reason, which we're starting to figure out, the kids, young people handle it well. That doesn't mean that some people's genetics don't allow them to handle it well, or they might have an underlying condition. But right now in Clark County, we only have 3 deaths of anyone under 24, under 25 from COVID. And that's about 600,000 people in the county are under 25 years old. So, but if you're 65 and over, or you have high risk, COVID is definitely more deadly than the flu. No question about it.
No question about that. And it is a serious condition, and it does need to be taken seriously, and the people who are at the highest risk should be handled with care. We did a horrible job taking care of the elderly, and it is very serious. At the same time, though, we do have to look at what the positives that are coming out of this, and we do have to look at how we fix this, how this is going to resolve. So by pointing out what the herd immunity and the T cells and that kind of thing, is not dismissive of the disease at all,
Right.
but we do have to look at what's going to help us. So I get really frustrated when people just only want to focus on the negative, and then they get into that bantering and personal attacking stuff. Drives me nuts. So
Well,
thank you for your perspective.
I'm a person that's always tried to focus on hope in any situation, even in the darkest situation, because I've been in healthcare for 27 years. I've seen a lot of people die. I've seen a lot of bad things happen. I worked with spinal cord injuries. I worked with cancer patients. I've worked with kids with cancer. Like, I've seen terrible things that make you want to cry and give up on life, right? I was so depressed in PT school when I worked at the children's hospital. I went home every day and basically cried for an hour because I saw 4-year-olds with cancer and 2-year-olds got hit by a car, and it was like, oh my gosh, this is, I couldn't deal with that, right?
Right.
But I've learned, even in the worst situations, we have to try to be realistic. And I think when people are arguing, when I put the information up, they're trying to say, be realistic, man. People are dying. This is bad stuff. I'm like, I know, I agree. This is bad stuff. But I want to focus on some hope here, because what England found is for every 3 COVID deaths they have, 2 people died because of lockdowns.
Yes.
Because of not going to get health care, suicide,
Yep.
drug overdose. So, so hope matters, right? Hope is important, that you see there might be another side to this. And I think, especially in Vegas, our unemployment's so high. Entertainers, I have a lot of friends who are entertainers because I'm an entertainer. I have a band.
Yeah.
And there's a lot of people that are just in really darkness about this because their whole livelihood is gone. Like, they couldn't get unemployment for 4 or 5 months. They're scrambling to eat groceries and to how are we going to make our rent payment? So it's a lot of dark stuff, a lot of bad things. People know people who have died from it, who are sick from it. So there's a lot of darkness, right? There's a lot of bad stuff that's going on, but I try to focus on the hope in the situation too. So that's where I'm coming from. I'm not trying to minimize the bad, but I'm trying to stay focused on, there's some hope here. With all the data that I'm reading, there's some hope. And I think things could be a lot better by November than they are now. So that's my belief.
And that's true about life. Every challenge presents hope. Every challenge brings a positive. So if we don't focus on the positives that could come out of this, then we will all die from depression. So, again, thank you for your perspective. Now, the time is going pretty quickly here.
Okay.
I want to cover quickly your take on the negative impact of wearing masks for prolonged periods, because I work with dialysis patients, and I'm wearing a mask 32 hours a week. And I saw something the other day where, OSHA requires those industries where the employees have to wear masks, that the oxygen level has to be above 19.5% or something like that. So if it diminishes with mask wearing, what negative impacts can we expect?
Well, I think one interesting thing with the mask stuff is we rarely focus on which masks are effective, versus which ones aren't, right? So the scarf mask, where somebody just takes a t-shirt and puts it over and it's hanging down, studies have shown those are not effective at all. The mask with the valve on them, so it filters going in, but it doesn't filter when you blow out. So you're really not protecting the people around you with that valve. So it really matters the material, how many layers you're talking. I work with a mask when I'm treating patients. I have to have a mask on the whole time I'm at the clinic. And it gets annoying, right? It does get annoying. It gets hot sometimes. But overall, I think most of the cloth masks being made now that fit your face, I believe that there's nothing showing that your oxygen levels drop, your oxygen saturation and stuff. So I think I would say for the most part, you're going to be safe if you're wearing a mask for 7-8 hours, especially a surgical mask. Like, a surgical mask lets plenty of air through. So I wouldn't be worried about it. Does that mean somebody may not have an allergic reaction to a material in a mask? No, that happens. But I don't believe there's a lot of hypoxic issues, like where people are actually not getting enough oxygen.
Okay.
or
Okay.
their oxygen sats are dropping too low. I mean, I don't think that's really true. So.
Okay. Okay. Well, thank you for that. So I know there are many things wrong with the healthcare system in the United States.
Oh Lord.
Can you pick the biggest problem and
All
tell
right,
us your
I'll try
take
to
on
do this
that?
very succinctly. All right, so because I have lots of debates about our healthcare system. So when I came out of my curriculum, when I graduated, I believed a lot of basic talking points by the insurance industry, the health insurance industry, right?
Right.
That all the other countries' insurance health systems were terrible. You had to wait for 9 months to see a doctor, blah blah blah. And I've been in Canada, I've been in some other countries, and then what really happened is, as I treated people in our system, I realized how many poorer people, or how many even working class people, can't even afford insurance or are not provided insurance. The bills, the medical bankruptcies, I started seeing how we are just not taking care of a fifth of our population. So right now it's about 50 million people in our country don't have basic health coverage. And I started reading the stock reports on United Healthcare, Anthem, Blue Cross Blue Shield, what they're paying their CEOs, 40, 50, 70 million dollars a year, plus a board 10 to 15 million dollars a year, plus shareholders getting so much in dividends. We're profiting off people suffering and dying. And that is immoral. Period. It's immoral. I mean, the people who got shot at the festival, some of them had millions of dollars of bills. Now, we know in the US there is something called a stop loss, which means you can only pay a max certain out of your pocket. But for many people, that's more money than they have sitting around. So I just think the idea of profiting off somebody's suffering is immoral. And then when you look at all the countries that have, all the civilized nations on the earth have basic health care for their people. Period. Every civilized nation on the earth has that. That should, so I see it as a basic, it's a human right. If I see somebody bleeding on the street and I'm driving an ambulance, I shouldn't have to think, well, I don't know if they have insurance or if we're going to get paid for this. So,
Is
you
it
know what I
covered?
mean? So I've just seen so much suffering because of our system. So whether it's public only or whether it's a public-private partnership like in Australia, in Switzerland, and other countries, we need to make sure every person in our country has basic health care coverage. And as you know, because you're in wellness, somebody can go 10 years and not know they have high blood pressure until they have a stroke. Well, if we could get in a doctor's appointment and
Right.
get a basic blood pressure reading and get a basic blood glucose test, we could prevent so much death and so much suffering. By the time you find out, by the time you have a diabetic coma, it's a little late to have treated all the
Way too
issues,
late.
right? So we see, and that affects minority communities much more than Caucasian communities, frankly. And so I'm just overwhelmed and burdened that our system ignores 50 million people and acts like it doesn't matter, that they can't get basic appointments at doctor's offices, at orthopedics offices, at cardiologists, at endocrinologists. They can't get care a lot. It's just horrific. It's horrific. And so we already, 1/5 of our country is already on Medicare. So, and I'll tell you this, here's a lie that happens all the time. The government's terrible at this and that. The government catches more fraud than any other insurance company. They do a great job making sure licensed people are giving care. There's all these guidelines, a lot more checks and balances. Are they perfect? No, but it's much better than our current system. So and you see COVID has brought out all those problems because
Hmm.
you saw what it's done to the minority community, the African American community, and Hispanic community. They have hospitalization rates 4 to 5 times of Caucasians. Why? Because for 40 years they can't get care. They can't
Right.
get screened. They can't get into a doctor. Oh, you've got Medicaid? We don't accept that. Or whatever. And it's a horrific, immoral system that needs to be stopped. We need to stop making profit off people's suffering. That's immoral. So,
Okay.
as you can tell, I don't really have an opinion about it. So.
I would like for you to say what you mean.
Yeah.
Well, and another piece to that is if you're not going to insure a certain number or a certain group of people, you're going to pay for it on the other end when they
That's
show
right.
up in urgent care and emergency rooms, and which is way more expensive than prevention.
Yes, so the taxpayer still ends up paying for it.
Yes.
Because UMC is taxpayer funded. All the money they lose from taking care of everybody who doesn't have insurance, the taxpayers have to make that up every year.
Yes.
So it's like, and here's another fact, Glenn. The average family of 4 in the United States pays out of their pocket $16,000 per year for medical costs, insurance, deductibles, out of pocket, co-insurance. That's the average family of 4, 16,000. Well, if you're going to pay that anyway, take 10,000 in taxes out of a family of 4 and make sure everybody has decent coverage that I don't have to wonder, entertainers, barbers, taxi drivers, Lyft drivers, they can't get insurance hardly. If you're a 1099, that's your biggest issue, is like, what am I going to do if I get hit by a car or something? Like, I don't have insurance. I don't have, and you try to buy it on the, I mean, at least Obamacare gave somebody something, some chance to get insured. And they denied pre-existing, or they stopped denying pre-existing conditions. So that was a great thing that happened with the ACA.
It was.
But we are paying for it, and the vultures, I call them the vultures, the health insurance companies, all these profiteers that are taking and raking the money out of the system for profit. If all that money was put into care, we spend double of any other nation per person on healthcare. Double. And we have the worst healthcare outcomes of any civilized country. So we are not getting what we're paying for. Where is it going? All that money is going in people's pockets. So the CEO of United Healthcare, Stephen Helmsley, can have his 15th vacation house. It's like, use the money for health care, not to give people profit. So anyway, that's what I thought.
That's great stuff. Thank you so much. Oh my God, you are just a walking encyclopedia.
I've dealt with healthcare stuff. I speak on it, and I've taught students for 10 years, and we would discuss and have debates on these issues and how do we fix our health insurance system. And the students, they come up with a lot of great ideas too, but COVID is terrible, and it has exacerbated, it showed all of our ugliness of our healthcare system.
Oh, it sure did. It sure did.
That's a sad thing. It's a very sad thing to see people suffering much worse because they didn't have care they should have had for the last 10 years or 15 years. And I would see those patients, because I worked in a neuro rehab unit for 2 years. So I would see all those strokes, all those, heart attacks, all these other conditions that if people would have just got preventive health care, I wouldn't have seen half the people I saw. So it's just sad. I've just seen a lot of suffering that was unnecessary. So,
well, and I agree with that. And probably 75% of the people who have kidney failure wouldn't have kidney failure. Yeah, because diabetes and hypertension cause kidney failure.
My brother was on dialysis for 15 years, and he had type 1 diabetes since he was 2. And that was the main, with diabetes, eyesight, kidneys, amputation, what happens. And you see it at the dialysis center. And probably half the people in dialysis center, if they would have proper care and done the right things, right? They have to make choices too.
Yes, they do.
They wouldn't be there.
Exactly. So having access and making choices is what we need to do better in this country for sure. Yeah. So David, thank you so much for sharing your wisdom and taking time out to be on the Glen Alex Show. So I appreciate you, and keep doing what you're doing.
Thank you for having me. You're doing a great job. All the stuff you're advocating for the community, and many people don't know about all the ways that you've been interacting to try to help the community. And so I appreciate all that you're doing as an advocate for people's health, for their wellness. You do life coaching too. You do, wellness coaching. You speak to groups. And so I appreciate the work that you're doing in the community very much also. Okay, thank you so much for that. I appreciate it.
Thank you again for tuning in to this episode of the Glen Alex Show. I hope you found David's information as valuable as I did. So please like, subscribe, and share, and allow me to leave you with this closing thought. It seems that we have forgotten the idea that health encompasses not just the absence of physical disease, but involves healthy habits, thoughts, coping mechanisms, and peaceful ways of relating to our environment and to others. That's from Own Body Health. Yeah, we have definitely forgotten that health is more than the absence of disease. True health is also about prevention and nourishing relations with self and others. Right now, our country is so divided politically, racially, and over gender stuff. All of those divisions are really about poor mental and emotional boundaries. More on that later. We as a nation are not healthy, and individuals do create the collective. So we can't just blame politicians who feed off of our individual unwillingness to engage in health daily. If we made healthier choices on a daily basis, we would have a healthier pool of politicians to choose from rather than the lesser of two evils. And those politicians would reflect our individual health. So don't blame them. Let's focus on what you can do, what I can do, what we can do for ourselves and for others to promote physical, mental, emotional, and spiritual health. How about if we individually be responsible for making America healthy? And with that, until next time, be well.